Hello, everybody. My name is John Vitas. So glad you could join us here on the I'm Speaking Plainly show. First and foremost, I'd like to thank Bill Hay for giving us a little bit of airtime here today. I want to talk about, I know Bill's doing everything about politics and so forth. And, you know, here's my segue. If you want to stand up for your rights, first you got to be able to stand. And if you want to be able to stand, you got to have some healthy feet. So I'm going to talk to you guys today a little bit about this product that I've run across. And by the way, I use this as well. And believe me, when I'm not on the radio being a superstar like today, I'm out there selling stuff. And so I'm going door to door. And believe me, I spend a lot of time standing on my feet. The Army barely let me in. As a matter of fact, they broke out of like a .001 feeler gauge. And they just said, okay, close enough. We'll go in there. So today is, I want to talk a little bit about to you. We're going to be on the air for probably about 20 or 30 minutes. So I want you to bear with us. This is good stuff. And everybody out there, I guarantee you that I'm listening today, at one point or another, you probably said, man, my feet are sore. Or you did like me or went to the store and bought $9,000 worth of Dr. Scholl's and all that stuff. And so, you know, it's very important. And I've got Dr. Vimal Reddy with me today. And Dr. Reddy is with the First Coast Foot and Ankle Clinic. And we're going to talk about this product. It's called it's 3D printed orthotics. And now you know how trick 3D printing is. Well, these guys have taken it to a whole new level. I want you to write this website down for me before we get started. It's fitsjax.com. That's PHITSJAX.com. And you can learn a little bit more about this product. But you know, the need for healthy feet. I mean, you guys out there, old and young. Sports people that spend a lot of time on their feet every day. You can relate to hopefully you can relate to what we're fixing to talk about. So first and foremost, let me welcome Dr. Reddy to the show. How you doing, Doctor?
Good. How are you? Thanks for having me.
Well, Doctor, I had a nice little bio printed out for you a little bit, but rather than me stutter and read, just tell us a little bit about yourself and a little bit about the clinic, if you would.
Sure. Well, I've been in private practice in Jacksonville for the last 10 years. A little bit about my training. I grew up in the Jacksonville area. I went to podiatry school down in Barry University in Miami. Mm-hmm. And then after that, I decided to do my residency up in the cold winter of Chicago. So that was great. I spent a few years up there, had a great experience. And then I did a sports medicine fellowship with the Miami Heat and Disney's Wide World of Sports.
Okay.
And then, following that, jumped in the world of group practice, private practice, and here I am today.
Now, I was in the opening, I was talking about, the need, for obviously good orthotics. It all starts right there. Doctor, who are some of the patients you're seeing? I guess I'm assuming it's probably across the board, but what is the brunt of the patients you're seeing down there?
Well, the brunt of the patients I see right now in private practice is really all across the board, but the majority of them are the, patients between, 40 to 65 years old who are trying to get more active again.
Right.
Because of the big, fitness boom. Everyone's trying to get more active because, health issues, everyone's trying to get healthy.
Right.
So it's important that you have healthy feet in order to do that. Because obviously if you're trying to run again, if you're trying to do the treadmill, whatever exercise is, feet are a big part of that.
Okay. Now, we're obviously going to talk about a 3D insole part there, but what are some of the feet and ankle problems that you treat?
Well, the most common problem across the board is going to be heel pain, plantar fasciitis. That's number one.
Okay.
But we also see neuromas, we see stress fractures, and we see problems with flat feet or severely high arch feet.
Right. Heel spurs?
Heel spurs, yeah, plantar fasciitis as well. Yep.
Now, on the heel spur thing, is it like they used to do to poor Johnny in the Army? They put you there and they give you a shot right in the heel? Is that still the deal?
In some cases, yeah, definitely cortisone is a first-line therapy in some cases, but in a lot of cases it's not.
So you tell your patients you're going to feel a little bit of discomfort or a pinch?
A little pinch.
Yeah, I get it. Hey, folks, if you're just tuning in, we're talking to Dr. Reddy. He's with the First Coast Foot and Ankle Clinic, and we're going to be discussing Fits Orthotics. That is a 3D printed orthotic for your feet. And, man, there's some trick stuff. I tell you, I got mine. And just like anything else, you're not just going to throw them in there and just automatically everything is great. Basically what they tell you, and doctor, correct me if I'm wrong because I'm wrong a lot, is when you get these orthotics, just like anything else, I want you to wear them for a couple of hours and do a little bit of walking around and everything, and then kind of go back to whatever you were doing a little bit. Don't just throw them in there and leave them there 24/7. And after a period of time, you will notice a difference. I've got the plantar fasciitis. Did I say that right?
Plantar fasciitis.
Yeah, I got that fasciitis stuff in, and even mine and I've had them for a while. I still don't wear them 24/7. A lot of times I'll go 2 days with, a couple days off, and it is starting to help a little bit. And folks, if you got this, that little bruise on the inside of your foot, that long bruise. Well, you'll watch it. Mine has just slowly gotten smaller and smaller and smaller, and the tenderness is going away. So I like anything that you can utilize without having to use drugs, and this sure fits the bill. Doc, the phone number over at your clinic is 739-9129. You're over there on 8075 Gate Parkway. What's the website over there for your clinic?
It's firstcoastfootclinic.com.
Here's that website again, ladies and gentlemen, firstcoastfootclinic.com. You can also tell I do a little bit of voiceover work. Oh, yeah, I got that in real quick. Okay, Doc, I think what I'm going to do here, since we still got a little bit of time here in this first segment, we can afford to be a little bit long-winded on this. So I'm going to go ahead and move in to the insole side of things. Okay, we're talking about Fitz insoles. They're 3D printed. How does that work?
Well, basically, the data is electronically issued to the 3D printer instantaneously. So we get a lot of data, very comprehensive data, where we can actually adjust the orthotic based on the patient's biomechanics, which makes for a more accurate orthotic.
Okay. Now, when you do these analyses, I think I was reading on the website, a lot of times and I've done this before, you go into the store or whatever, and you can stand on this thing, and they'll tell you what the best insole is for you and so forth. That's all well and good if all you do is stand, but unfortunately we walk and so forth. So you guys do, and I've heard of this in other fields before, but I think you guys do it a little bit different. It's called a gait analysis. So if you would explain to the listeners exactly what a gait analysis is.
Yeah, so the main difference between, what you see, people come into my office all the time and they're like, well, I went to Walmart and I stood on the Dr. Scholl machine. It's a huge difference. A gait analysis is actually we're examining your full gait, meaning from heel strike to toe off. So we can actually tell you where you're putting the pressure throughout your heel strike as you go to the midfoot, as you go to your toe off. And we can take that, that data and we can translate it into an orthotic, and we can make parts of the orthotic more thick, parts of the orthotic thinner, parts stiff, parts more flexible.
Right.
Based on customized biomechanical analysis, and that's the difference.
Now, there are other folks out there doing gait analysis, but I think the difference between you guys is their gait analysis is basically they'll say, okay, you got pressure here, here, and here,
exactly.
Whereas yours is you've got this much pressure here and that much pressure there. So that's really the difference in your gait analysis as opposed to the other ones that might be out there.
Yeah, because we can quantify that data. We can tell you exactly what is going on, exactly how much pressure, and then we can translate that into the 3D printed orthotic and make it just as rigid as you need, which is the beauty of it. You can really customize this and make it as dynamic as you need.
Okay. I want to kind of circle back a little bit about your practice. First of all, how long have you guys been doing this orthotic?
The Fitz orthotic we've been doing for about 2 years now.
Okay. So pretty good success with that?
Oh, absolutely. And people love them from the traditional orthotic because the traditional orthotics, I'm sure a lot of people have them out there. They're hard plastic. You can't get them in many shoes. But the Fitz they're very thin, but at the same time very supportive. So you can fit them in a lot more shoes. We have a lot more patient compliance, and then you have a lot more people that like them because they can wear them for different occasions. Well,
it seems to me if you're equalizing the pressure throughout the foot rather than on one spot, that's got to be better because obviously the more we disperse weight, the better it is. So I guess that's the key here.
Yeah, absolutely. I mean, orthotics we're using for that reason alone. We use them anywhere from the sports patient to the elderly patient with balance issues.
Okay. Yeah. Folks, we got to go to break here in just a second here. Got a minute till break time. I'm talking to Dr. Vimal Reddy. Doctor, did I say that right?
Yep.
Okay, talking to Dr. Vimal Reddy. There's my little stutter for today. He is with the First Coast Foot and Ankle Clinic. They're right over there on 8075 Gate Parkway. The phone number over there is 739-9129. And believe me, these cats know what they're doing. We're talking about Fitz Orthotics. They're a 3D printed orthotic. Yours truly wears them, and I love them. Hey, we'll be right back for segment number 2 here in hour number 2. This is John Vitas. You're listening to the I'm Speaking Plainly show. We'll be right back after these short messages.
Let's get back to I'm Speaking Plainly.
What you got to say?
To join the conversation, call 222-TALK.
Say, hey, hey, hey.
That's 222-8255.
What you got to say?
Once again, here's Bill Hay.
Well, and welcome back to the I'm Speaking Plainly show. I'm sitting in for Bill Hay. I'm John Vitas. We've got about 14, 15 minutes. We're going to talk to my friend Dr. Vimal Reddy, and he is with the First Coast Foot and Ankle Clinic. And I want to once again give everybody this website because this is the product we're talking about. It's FitzJax.com is the website. That's PHITSJax.com. On that website, you will find a lot of information about these 3D printed orthotics, and you can see for yourself that these are, in fact, pretty much a one-of-a-kind. This is a relatively new process, and obviously we know how trick 3D printing is. And so I want to harp on this. This is these guys, yes, they're a client of mine, but I don't get on the air and promote a product unless I believe in it. And that's pretty much the way I sell radio. I believe in radio, and I believe in what it does. That's why I go out and sell it, and I do a pretty good job at it because I believe in this product that I sell, and I also believe in this product that I wear, and that is these Fitz orthotics. So if they're good enough for me, by golly, they're good enough for you. But seriously, this is a great product, and I know that the people out there in the listening audience, there's a ton of you folks, especially, you cats that are, between 45 and 60. That's where I fall. And so you probably mistreated the heck out of your feet, especially you cats out there that are standing pretty much all day at work, all you construction people out there. And actually, we're going to talk a little bit to the doc about the sports side of these Fitz insoles because they're definitely catching on in professional sports. And one thing I think that we can agree on, Doc, if you can find an issue with your feet at a young age, that's the time to where if you jump on it, then you won't be going through some of the stuff that I'm going through today.
Yeah, absolutely. If you can find, a biomechanical issue at a young age and you can start wearing orthotics when you're very young, then that does prevent, further problems going forward. And we see that a lot, in athletes. By the time they get to the elite level of their sport, they don't have any orthotics or any support. So giving them that support actually helps them a lot. Now,
how are we getting the message out to the younger sports program, maybe like the high school sports folks and all that kind of thing? I mean, obviously, you probably cover a good bit of that on the website. But is there a good way for us to reach out and make this product known other than what we're doing already? We're doing some radio advertisements, so that should get out to people. But do you guys ever go to any of the sports medicine doctors or visit some of the high schools or any of that kind of thing? How's that done?
Yeah, definitely. We'll visit some of the high schools. We'll do health fairs. We'll do screenings and things like that. A lot of times, before high school sports, they have history and physicals. So a lot of times we'll do a lower extremity examination of the foot and ankle. And we'll just, if there's any issues that we can see, we'll address that. We'll note that.
Okay.
And, not everyone wants orthotics because not everyone's in pain. But the goal here is prevention.
Exactly.
Going to the future, if we see something that could be an issue.
Well, in this world we're in now, where everybody's chomping down handfuls of opiates. Yeah, it's nice. It's nice to find a brace or a wrap or something that believe me, me and my TENS unit, we're real close. So I try to do everything I can do to escape that. Now, I want to move forward a little bit, and when you do these shows and so forth and go out there, you guys can take that gait analysis unit with you, right? So you can give readouts for people right there on the spot.
Yeah, it's portable. We can take the entire system with us, with a laptop, and we have all the data just like you're in the office,
right?
Which is the beauty of it.
Now, speaking of the office, typically if a new patient calls your number 739-9129, how quick can you usually guys get your new patients in? Pretty fast?
Well, we can get them in within 1 to 3 days. I mean, it's same day if it's necessary. Usually within 3 days we can get that patient in.
Now, I know back in the day when I visited my friendly podiatrist, they used to do some, I think you would actually stand on and they would x-ray your feet from the bottom. Is that something that's still fairly common in your business? Or
we have x-rays, but it's not this. The Fit scanner is a lot different than the previous technology.
Because it reads pressure. It doesn't necessarily have to go through something to see what it's doing. Exactly. Now, I've noticed on these printouts that because, obviously I had one, your pressure points, the heavier they are, the redder they are. Is that the way it is? So that's the way you can kind of tell. So just because you've got a heavy spot on your heel, that circle might be very small, and so that's a different setup that you would need rather than if the heel was showing all red all the way around, that was an extreme pressure point. So I guess at that point you would try to get that arch or something maybe raised a little bit. Is that the concept?
Right, that's the concept. And the good thing about the Fitz product is that you have a dynamic gait stand with a lot of data. So you're not looking at one imprint of your foot. You're looking at, going back and forth several times. You're looking at about 15, 20 different times in the gait cycle. So you can really get a good idea of what your foot is doing as opposed to one scan of this or one scan of that. So you get a lot of different data points that you can go.
And I think it's good that obviously we're doing both feet here in motion because in my case, I've had like multiple knee surgeries on my right leg, and it's actually a little bit shorter now. So all that stuff was different. As a matter of fact, when I had you guys make mine, I was like, okay, now remember, I'm going to get a new knee put in this right side eventually. But it is weird because, my right foot, the pressure points were just totally different than the left. It looked like the left was off a complete other person. So I think when we're talking about taking these measurements. This isn't a rough measurement or a guesstimate. This is about as precise as it can possibly get, isn't it, Doc?
Yeah, absolutely. That's why I love this device. It really takes the guesswork out of it. Instead of guessing, is this patient doing this or is he doing that? You
Right.
can see, okay, it's happening here, and this is how we correct it. And that's the beauty of it. And also, the fact that the device is customizable within the device, meaning you can make some parts of it soft, some parts of it hard. You don't have to make the entire device the same thickness, which is great.
Right. Mm-hmm. And especially in my case, because that right one, I hope they may make it a little bit thicker to kind of offset that, or I'd just be walking around in circles everywhere I went. Okay, I want to talk a little bit about these the problems. If you're not attentive to your foot issues, this can actually start leading to not just sore feet, but there's a lot more involved with this. It just carries its way right on up, doesn't it?
Yeah, absolutely. Compensation is a big part of it. What I mean by compensation is, say, your right foot starts hurting over time. Naturally, your body's going to compensate for that. So you're going to start putting more pressure on your left side, and that could lead to left knee pain, left hip pain, left back pain.
Right.
So just a simple foot issue can lead to really bad health problems going forward if you don't correct that.
Well, I think it's pretty safe to say that the feet, I mean, that's what, the buck stops there. I mean, that's all the weight is on them. And so when they're not right, all it does, it's just going to, like we talked about, it's going to move right on up the hill. And this is not just joint issues. This can happen with muscle and calf pain as well, right? Because of you're trying to offset.
Again, it's all about compensation, meaning if your right side is hurting, your body is putting more pressure on that left side to compensate for it. So you can pull a muscle, you can strain, your plantar fascia. Plantar fasciitis, believe it or not, is very common because of that problem, that compensation issue.
And, man, that is painful.
Yes.
That is very tender. You don't have to poke it to say, does this hurt? You already know, right?
And almost everyone has had it at one point.
Right. It's crazy how that goes. And it, I guess, I don't know why mine occurred on the right or the left, but I guess it's probably, like you were saying, that I was actually putting a lot, shifting my weight around trying to compensate. This product has made its way into the pro arena. There are several pro sports people that are using this product. Tell me about what's going on with Fitz insoles over on the pro side.
Well, there are several NFL teams, pro soccer teams, that have had this in their cleats for almost over a year now. And the reason why they like it is because of the fact, again, because it's so thin, but it's at the same time it's so precise. So you can, these players are big players at a high level. They don't want to wear different shoes based on the insole. So you can fit this insole in their current shoe, and at the same time get the unbelievable correction as a standard.
Yeah, it's one of the things I've noticed when I was doing the old insole chase before I found your product is you'd find an insole that was comfortable, but then you'd have to go out and find a shoe that's extra wide to kind of suffice for that thing. So yeah, it's a decent deal. Now these pro teams, I think another one of the things that we need to get out. Of course, you said that the product was thin. And one of the reasons it's thin, this is not a piece of foam that takes care of the issue. This is actually, I guess it's somewhat of a composite product, like a plastic or something, if you will.
It's a plastic polymer that's very hard. Okay. Again, when I say hard, it depends on the patient. Again,
right?
I mean, it can be super hard in one spot and very flexible.
Right, put a little cushion in the other.
So that's a great thing about the technology, about being printed on a 3D printer, is you can get that lightweight honeycomb effect.
Right.
That really makes it good.
Now, more about the product itself. Once you go in and you do your gait analysis, so forth, you guys can pretty much right there at the completion of the gait analysis, once you put all the information in, you could literally order that orthotic pretty much right after someone's gait analysis, correct?
Instantly, yep.
Okay. I want to put something out there, folks, and I don't know why insurance companies do this. Here's a good example of what makes me scratch my head. My insurance company will pay for glasses till the day I die. But let me go in there and ask for some LASIK surgery so they don't have to pay for glasses anymore, and they don't want to pay for that. So I want to get this out front. This is not an insured product. I still feel like it's affordable. Doc, it's one of those things. I don't mind paying a couple of $100, $300, $400, $500 if it means that I'm not going to hurt anymore. I'm not having to take drugs. So yes, there's a lot of orthotics out there that, because I've seen this in my knee brace stuff. I mean, my DonJoy knee brace was like $1,500, And so, the price for comfort, you can't put a price on comfort. It's just like I don't mind driving across town to go to the good restaurant. So, this is a product that's not insurable, but believe you me, I'd start putting some ducks away on the side because this product really works. This is not some new gimmick. 3D printing is here to stay. That's about as exact of a measuring system as you get. It's almost like, you guys are literally doing a CT scan almost and then sending that information out there. The product itself, How long does it take to produce it once you guys send in the paperwork?
From the time I send out the order with the computer electronically, we have it back in our office in about 2 weeks. So it's very quick.
So pretty quick turnaround time. And I know this varies because obviously there's no way you should be able to hurt these things, but there is a warranty that comes with them. If you pull it out of your shoe and it breaks,
it comes with a 2-year warranty.
They'll hook you up with a two-year warranty. Okay, I've got to get out of here real quick. Once again, I'm talking to Dr. Vamil Reddy. He's with the First Coast Foot and Ankle Clinic. What's that website again, Doc?
FirstCoastFootClinic.com.
Okay, and he is he sells these 3D printed orthotics, and he can get you fitted for one today. Doctor, real quick, if our listeners call into your place, what you going to offer them?
Well, we can offer you 20% off in orthotics.
Okay, there's 20% off an orthotic. That's a good price. And believe me, they are a great product. I wear them myself, Doc. I want to thank you